everybody. Thank you so much for joining us again today. We have Dr. Scott Spear, Medical Director, Student and Employee Health, and Associate Professor of Pediatrics. Dr. Spear, how are you doing today?
Very good. Thank you. Thanks for having me.
Thank you for joining us. All right. So, Dr. Spears, is the Student Health Clinic available for all students?
Yes, it's all currently enrolled students. If you show up on our system when you call us, we have a way we can tell that you've paid your tuition and you're eligible to be seen here. And this is also, you ask, is this for students who are not on campus? Absolutely. We're still doing a lot of our encounters via telehealth. So we can either do a Zoom call like this with students, or we can call them on the phone. Sometimes they'll send us a picture of something, whether it's a skin condition or swollen toe or something they're concerned about, and we can look at that and then call them and talk about it. That's both, to allow them not to have to come to campus and expose themselves, and it also prevents them from potentially exposing people on campus if they don't know that they're infected. So we're doing quite a lot of that as telehealth. We want to see people. We're going to screen you if you call and say you want to be seen. We'll call you back and screen you for whether you might be infectious for COVID. If you are, we'll test you for that. If we've determined that you're not, and it's something that we both agree needs to be seen for us to manage, then we'll give you an appointment to come in and be seen. But again, we're available for students who are enrolled, whether they're physically here or not.
That is great for all students in general.
Absolutely.
So how can students make an appointment at the Student Health Center?
They can go online and make the appointment. They will get a time slot, but again, they should be expecting us to call them and not showing up. When we're not letting people just walk in. They have been screened to make sure that they're not infectious for COVID before we will have them come into the building. And then when they come in, we'll also screen them for with the temperature as well. So we have a set of questions. So when they've made those appointments, we'll look and we'll see, and we'll call them and then determine if they do need to be physically seen. We'll call them and we'll set that up when we call them.
So if a student shows COVID-19 symptoms, can they be tested at the Student Health Center?
Yes, we will generally test them. Again, we'll screen them, and if they have typical symptoms, we're generally doing it as a drive-through here. It's different than the drive-through for the greater public. We do it right behind Student Health. We'll give them a time to come in. We generally want them to come in their car, just because right now it's a little bit easier. If people don't have cars, if they're in dormitory here on campus, they can walk over. And we're doing it outside because that reduces the risk of exposure to others if they do have COVID. They need to wear a mask, and we wear masks and gown and gloves, and we can test them. We have the results back usually the next day. We're using the same lab that the drive-throughs are using, the drive-throughs that are currently in Edinburgh and Harlingen and Weslaco and Brownsville. The same lab on campus runs those, and we get the results back the next day. And we'll then either call the student or in most cases send them a text message through a secure website, and it has information about what the results are and what they can do for management.
Okay. Is there a fee to be seen at the Student Health Center?
No, there is a fee for some lab tests and for medications and for some what we call durable medical equipment like crutches and air casts and things like that, but there's not a fee to be seen.
Okay. And if a student doesn't have health insurance, can they still be seen at the Student Health Center?
Yes, we don't actually bill health insurance. If you're expecting to use your health insurance, we can't help you with that. So, if they want their health insurance to pay for medications, we can send the prescription to a pharmacy where they can use their health insurance, but we don't take health insurance. We're not asking for health insurance. So we see many students without health insurance. The challenge becomes if you don't have health insurance and it's a problem that's beyond what we can manage in student health, even something like an x-ray, then it does help to have health insurance because when we send you out, that's not covered by your student health fee. That's something you have to to provide and pay for yourself. We do, with students that don't have insurance, don't have health insurance, we do try to work through some programs that are existing in the Valley. We have a lot of skilled folks here to help arrange those kinds of appointments. But we recommend that all students have insurance. We know that they don't, but they don't have to have insurance to come here.
Is there anything else, any other health tips that you want to add for students?
Well, I think the main one is that, if you're, the only place you really should take your mask off is if you're, in your car by yourself or in your room by yourself. If you're going to be socializing, it needs to be done with a mask and needs to be done with social distancing, and the kind of expectations we're going to have when you're in a campus facility should be the same whether you're in campus or in a campus dorm or in your own apartment. We have, the majority of the people we find that have become infected through people who they're encountering either in their home environment or in their friend and family environment. So the same thing holds. I think, when we had the reason we're having this large number of cases in the Valley now, I think, is because when things were loosened up around Mother's Day, people started going back to family gatherings, and then we had Memorial Day family gatherings, and then 4th of July family gatherings, and people weren't social distancing and wearing masks. And again, that's what we know can help prevent transmission of this virus, and we're going to have to continue to do that for the foreseeable future.
Dr. Spear, thank you so much for joining us today and giving us a little bit of your time. Last but not least, can we get a visa?